in 2022, which was just last year, more than 1,200 Ghanaian nurses joined the UK's nursing register. Just 1 year alone, about 1,200 Ghanaian nurses joined the UK's nursing register. And the consequence is big on our health system, which is already, like I said, which is already struggling. And you have a lot of them moving out to seek only better opportunities, really. Richard?
Yes, I just want to give you another story which was published by the BNFG.
Okay. When was this?
In October of 2022.
Okay.
And the story is titled Nurses Ran Away to Greener Pastures Abroad. The story says more Ghanaian nurses are in the process of securing visas to practice abroad. A situation most of them say is born out of poor working conditions in the country. Now, over the past year, there have been increased cases of Ghanaian trained nurses and other health professionals traveling outside the country. A general nurse who wishes to be known as Alawani last month secured a job and visa to the United Kingdom. Now, prior to the new appointment, she had been practicing at a hospital in the Eastern region for over 7 years. Asked why she chose to leave, she indicated that she has nothing to show for the years she has been working in Ghana as a nurse. Now, she lamented the meager salary, poor conditions of service, and risks nurses have to endure in Ghana's health facilities. There's a direct quote here that says that I am very passionate about my job and I work really hard, but the economy is too hard on us. A lot of nurses are leaving Ghana to countries like the UK and US for many reasons, including good salaries and better employment contracts. The quote continues, for the idea of nurses seeking opportunities overseas, because we live in a country where nobody cares about you as a nurse and you are underpaid for overworking. You cannot even take good care of yourself and your family, she said. Now, according to Ms. Alawani, leaving the country to practice in the UK was her only option after furthering her education and obtaining a degree in nursing. Now, comparing some conditions of service for nurses in Ghana and the UK, Ms. Alawani said, quote, in Ghana, the normal work hours are between 8 to 9 hours a day. And sometimes you even end up working for up to 14 hours or more and earn a monthly salary. It is the same salary even if you work extra hours, and nobody really cares about your efforts. The quote continues, here in the UK, it is a totally different situation. If you do more hours, you get more pay. And every company has its own number of work hours per week, which is usually between 39 to 42 hours. So for instance, if you do your 39 hours before the week ends, you have more hours to do extra time for extra pay, she added. Now, as regards earnings, she noted that salaries in the UK are far better and more encouraging than what nurses earn in Ghana. There's a direct quote here. For instance, back home, Ghana, if you work for 9 to 12 hours a day for maybe 4 days in a week, you earn a monthly salary of about 2,000 Ghana cedis, regardless of how long your shifts last. But in the UK, you could earn a minimum of £12 or £13 per hour. So if you are working for, say, 12 hours in a day for 4 or 5 days, you can imagine how much money you earn in a month. Another issue, another nurse actually, who for the purpose of this article wants to be known as Adora, has been practicing as a nurse at a fertility in Accra for 10 years. Now, she also wishes to leave the country. According to her, that is the right decision because the salary abroad is better and worth the effort to put in. Now, there's a quote here that says, you will enjoy better living conditions. I will leave this country if I have the opportunity, she stated. When asked whether they are aware the decisions to leave the country to practice elsewhere may affect Ghana's health sector negatively, responses from these nurses varied. For Ms. Alawani, even though more nurses are being trained in institutions each year, she believes the country will lose out on experienced personnel, and that should be of major concern to the authorities. There's a quote here that says that most of my colleagues have left and others are willing to leave too. The situation would affect the health sector in Ghana because you end up losing competent and experienced health personnel. Our leaders may think that if you leave, there are always people in the queue seeking employment, but they forget that experience is very, very important in the field, unquote. And Dora, on the other hand, feels, quote, there are a lot of people being trained and immediately the economy becomes stable, the remaining will stay, unquote. Now, the minority, we are told, calls for action. Meanwhile, the minority group in parliament last month directed government's attention to prioritize the welfare of health personnel in the country so as to curb high attrition among the workforce. Now, there's a statement that is released by the minority, and the statement is quoted here in the story and quoted the Honorable Minta Kando, who is the spokesperson for the minority on health matters.
So listening to you and listening to the report and all the voices, the thing that runs through it, it's just better living. People just want better for themselves.
There are five main things: poor salaries,
yes,
of service, heavy workload without incentives, inability to save from meager salaries, poor pensions and security, and lack of career progression and opportunities. These are the 1, 2, 3, 4, 5 main
reasons
that appear to be driving the surge outside.
This, we are sometimes it's beneath. This very troubling because now the doctors and they are just leaving.
Well, I think it's just.
I mean, you know that this is not the first time we
I was just going to say that the nth time, man, that we're talking about this. And why are we still talking about this? Because the end is not in sight anytime soon. And I I think the whole exodus has been exacerbated by the challenges that the economy is facing, which also reflects in people's pockets. The UK is on an atrocious campaign to recruit.
I like the word atrocious.
Yes, campaign to recruit foreign nurses because obviously it's cheaper for them, and also it replaces the aging population of the nurses in the UK and health workers in general. And so it's not the UK is not going to wake up one day and say that Ghana we won't take the people again. No, they will keep coming for the people. And so we need to sit and also strategize on how we are going to, if you like, minimize this exodus. Because as for stopping, we can stop it. It is not a phenomenon that just started, I must say. It didn't just start. In the early 80s when the exodus to Nigeria came, every hospital took a hit. And it was across professions. It's only looking like this time around, the health profession is in serious danger, especially nurses and care workers. You know.
Yeah.
And you made mention of an estimated 1,200 nurses leaving Ghana
last year.
Only last year. Now, those 1,200 nurses leaving Ghana would actually represent 10% of all the foreign nurses outside of the EU that were recruited in the UK last year.
So meaning if that's 10%, so we are talking 12,000.
No, I take it. I think it's 5%.
5%, okay.
Because they were able to get, I think, 21 to 22,000 nurses outside of the EU, into the UK. Out of that, 1,200
came from Ghana.
Okay. How many countries are we talking about?
A lot.
I'm sure a lot more would have come from Nigeria as well. But granted, if 1,200 on record to have left Ghana, and every year we are recording 1,200, what are we going to be left with in the next 5 years? Just 5 years. Because this is just UK. There are a lot more going to Germany. There are a lot more going to Canada.
Yes.
There are a lot more going to the US.
Yes.
And
Australia.
Australia as well. So you can round this whole figure up to say 3,000 to 4,000 every year. We are finished. And we may sound like noisemakers on radio until you that are listening to us, who is a rich person who can afford any and every hospital, you are exempted somehow.
For a while.
Yes, for a while. But that nephew of yours, that beloved niece of yours, who unfortunately was a victim of a certain illness or a situation, gets to the hospital in your absence, and guess what? There are no nurses. There are no nurses, or the nurses that you meet there are not qualified. Even if they are qualified, they are not experienced. The other day, a niece of mine visited one of these clinics in their neighborhood around Taifa area. And she, I think she had, I'm trying to get the proper word for it. You know, the kind of sickness the young ladies get when they are within their period.
I don't know that.
Okay, well. Is it the dysmenorrhea? Is it what they call it?
Well,
I don't know.
It could be, because
Anyway.
I know it's one
yeah.
of those conditions.
And then she was injected by some nurse.
I think it must be endometriosis.
Okay,
So
whatever.
it could be. I mean, there's
You know,
that.
and then they
there's
just
all the
injected
others.
her, and then she started getting this serious swelling. And 3 days, the swelling wouldn't stop. So quickly, I said, don't joke with things like this. You have just been treated by a nurse who is not experienced. So I had to just carry her, take her to Nyaho Clinic for her to be sorted out. Now, what if we didn't have the means, which is the situation of many? The nurse situation is a very dark situation in the narrative of Ghana. And I don't get the urgency from policymakers and the health ministry on how to resolve this thing. I don't know whether it's just a matter of health ministry or education ministry as well.
I think it's a mix of both, because there's a training component, and then you have the health ministry who has to post. The ministry has to post and employ all these people, and then there's also the finance component, paying them.
Everybody thinks about their quality of life.
Everybody.
You cannot begrudge
No, not at all.
a living, breathing being the opportunity to, in fact, it's a constitutional right. If you check the directive principles of state principle, you know,
State policy.
State
directive
policy.
principles of state policy.
The quality of your life is guaranteed by our constitution. So we should ask ourselves, what is the situation that we find ourselves in now that has a lot more people thinking about their quality of life not being met here, and will do anything to find it elsewhere? It's the nurses, it's the doctors, it's the teachers, it's the lawyers can't run away too much, but if they have a chance, they will run. It's the journalist. No, it's true. I'll tell you something. I know of a show, a sister station, where in the past 1 year, 10 people, producers, not even on-air personalities, have left.
To the UK.
UK,
Wherever-
US, Canada.
Producers.
Yeah, I mean, people produce shows.
The
Yeah.
product people who
Yeah.
are in the
I'm talking about people in media. I'm making references.
Okay.
To people are thinking about the considerations of quality of life
Oh, okay.
across professions. Okay. Everybody listening to us, I want to take a very different tangent, and then I'll end up somewhere. Everybody listening to us wakes up thinking about how they can improve their life.
No, that's true.
A lot of us, maybe some of us even here, who might not say it publicly, who are at home, who might say, the nurses and doctors are running away, are probably considering options that improve their quality of life. Oh, it is true.
Did you say probably? No, that
is your shock.
I'm shocked.
Most likely.
He's giving room. He's giving room.
Yes, I don't want to use exact
hold your
terms.
thoughts. Don't forget. Let me tell you something. So I met a distant relative of mine who did psychology in school, psychology, political science and philosophy or something, and now she told me that she's been wanting to travel out of Ghana and the thing is not working. So she has checked into a nursing school.
Yes. It's become part of strategy.
to study nursing
and leave quick.
And it says that she's doing the diploma, which is 2 years, so that she can get the chance to leave Ghana.
So you see, if that opportunity were open to other professions, basically you would have 3,000 nurses leaving, 3,000 doctors leaving, 3,000 lawyers leaving. The point
maybe not 3,000 journalists.
No, everybody. I'm just 3,000 journalists.
Maybe like that 2,000.
If you talk to our footballers, everybody wants to leave. Why? Because they feel
quality of life
will improve out there. Whether it is true or not is another thing. Because as Attah-Mensah has explained, when the reality starts biting, when you get there, when your income level gets to a certain point and your lifestyle and your family growth also gets to a certain point, you would realize that perhaps things are a bit hard. But a lot of people weigh these things and say, I would rather take my chances there with that balance than take my chances here. Because there might be other buffers that they will get that they won't get here. Here, if you misbehave, sugar po.
And I want to say,
you might be surprised. You see, I'm saying people would prefer to hedge those bets.
Okay, that's true.
Okay. What we need to ask then is, why are we here? And the big question that another person asked, what has been the response of the state, and not just this state, of other states, to this? You see, because it is the responsibility of the state to provide the environment and the systems and the structure that makes sure that a nurse is paid well, a nurse knows that they have access to A, B, C, D. And so, even if there is an opportunity, there might be an iota of doubt based on the fact that, this thing, Krabi, I get some for Ghana, so I can stay. At the moment, there is zero consideration. Now, if you check, I'm going to tell you something that leads me to a bigger conversation. If you look at the World Health Organization's health workforce support and safeguards list for this year, there are 55 countries on it. Of the 55 countries, 37 are in Africa. I can mention their names. You can look at the types of countries they are.
55 countries.
Liberia is on the list. Yes,
Africa.
I'll mention the other countries. I will mention every country on the list, but I just want to get a feel. Okay. So Liberia is on the list. Lesotho is on the list. Guinea-Bissau is on the list. Ghana is on the list. DRC is on the list. Comoros is on the list. Chad is on the list. Central African Republic is on the list. Cameroon is on the list. Burkina Faso is on the list. Mali is on the list. Togo is on the list. South Sudan is on the list. Zambia is on the list. Rwanda is on the list. Nigeria is on the list. Malawi is on the list. Then I'll move to Eastern
What's
Mediterranean.
the name of the list again? What the name of
This
the
is the World Health Organization's health workforce support and safeguards list. These are countries whose health workforce you are not supposed to target because of the delicate state of the health systems there. So if you take from them, they will not be able to meet the global standards for health. Then on the list as well, you have Yemen, you have Somalia, you have Pakistan, you have Timor, Leste, you have Nepal on that list. You have Kiribati, Tuvalu, Vanuatu, Samoa, Papua New Guinea. They were just recently added. They are from the Western Pacific regions. You put all these countries together, it's easy to identify the countries that are not there, is it? And
Very
so,
easy.
exactly. And then you ask yourself, what is the problem then? You see, which brings us to the larger problem we've been having about even the nature of African countries and governance and the problems that we have been struggling with. Because there seems to be an inability to provide. The inability to provide is linked with these things. So South Africa has its big
And
issues.
linked to other things.
Yeah, we discuss South Africa every day for a wide number of issues. Are they on their list?
They are not.
We discuss Morocco for a wide range of things. Are they on their list?
No, they are not.
We discuss Seychelles for a lot of things. Are they on their list?
They are not.
Tunisia, they are the dictator who is there doing mad things now. Are they on their list?
They are not.
Algeria, are they on their list?
Mauritius is not on there.
Even Libya is not on this list. You understand? Even Libya, dysfunctional, failed state Libya, is not on this list. You understand? So our governments need to sit up and ask themselves, why are we unable to fix a situation whereby we have so many of our trained professionals willing to look out of their window and consider the slightest escape?
One time. Through McDonald Aviation,
Yeah, cool.
the gun.
Yeah, I tell you.
You understand? And the situation that Samuel spoke about, you see, we're not talking about hundreds of thousands, but the thing is this. These professions, there's a reason why there's a vulnerability list. 1,000 doctors leaving, or 1,000 nurses leaving, or 1,000 nurses leaving, and even 200 doctors leaving per year, multiplied by 5 years.
You're done.
The country will die. You understand? And the point is also this. I read the text that said rich people can fly out. This country does not have that many rich people. A lot more poor people will die. This country is 64% poor. Those of you who have not looked at the Ghana Statistical Service data, more than half of this country is legally poor, according to the Ghana Statistical Service. So, if we cannot find we cannot find the healthcare. It is not proper in the first place. You have to do cash and carry to get it. Now, I do the cash and carry, find myself a hospital, get there, and there is no nurse, there's no doctor. Why? What have we done? So, the authorities, the government, should look at this departure, this exit.
Exodus.
Yes, this exodus as a verdict on what they have not been able to do. We hear the health minister talk all the time. I have not heard him say a word. Well, at least maybe he said it somewhere. I haven't heard. What meaning the audio that we played, the audio clip that we played.
I think that's where they took them to Barbados.
Yes,
You know?
It's just like I confirmed that ran away to Burkina.
See? Because you cannot separate this exodus from general economy.
Not at
Oh,
all.
yeah, of course.
You see? So if the economy is not fixed, these people are not there. If the economy were fixed, we'll probably be able to pay them better. They would have better quality of life because the doctor knows that, or the nurse knows that when I show up for 6 hours of work, I get this and I go. Sometimes you meet doctors, and Bernard has more doctor friends than I do. There was time he was talking to one who basically had broken down. He had done like shift upon shift up.
Yeah.
Legally, he's required to take a break. But if he takes a break, people will die because there are no other doctors. He's there. So he's taking shift after shift, hoping that once he's done his bit and he goes, the other person too will come and perhaps will do the same. So I look at all these messages and all those things and I say, look, it's a damning verdict on the inability of the state to provide. That is what I see. It is a damning verdict on the state's inability to provide for the citizens the way they're supposed to. It's not that we're asking for much. No, I don't think the nurses are saying pay them 600 euros an hour.
Just pay us what is due.
Pay
us.
what is due and pay it on time.
Yes, just pay what you have promised. It's just as simple.
You see,
as that.
sometimes it's the difficulty of that. I'll tell you a typical example. When I was doing my national service back then, we used to collect our monthly thing at Golf House. Then there's
a bank.
There's a bank
yeah.
there. You will queue for your small money.
There's a bank's problem.
No, sometimes it was a general thing. A lot of the time, if it was national service payday,
You could
they create a queue for national service pay. So you can queue for 3 hours to collect your 120 or something Ghana cedis. So imagine a nurse or a doctor. And I was frustrated by it then. And lost and said national service asked me to do it again. I won't do it. Today, they have not been paid, their salaries delayed, they've increased it will still delay their serving. But my point is this doctor or nurse that we like to curse, that we like to insult because they don't do their work well for whatever reason. Those who do their work well. They go to work for 12 hours. Mm-hmm. Their allowances are not paid on time. It is not. They say it's not enough. The salary is not good. Some of them don't have accommodation. They work in all kinds of conditions. They do not have the tools with which they can save lives. Because they want to save the lives, but the doctor is looking for something, he cannot find it there. He's calling and they say the hospital cannot afford it. And you expect this person to be patient with you for how long? Eventually, either the person wears out, you see, and I'm even surprised that we are, because you are supposed to be in a certain frame of mind to be able to work in a hospital as a doctor or a nurse. You can't be beaten up by the complications of life whilst you are thinking about saving a life. You're supposed to be thinking straight about the complications of the medical process that you're going to go through, which is why you would have a polytrained nurse injecting somebody with menstrual issues with something.
Godfred, I was talking to a group of students who were undertaking a research, some research, and they were telling me that some of their findings actually reveal that, I think they are working with nursing training, healthcare training institutions, and they said that for the final years that they were dealing with, about 8 out of every 10 final year students they spoke to had plans of traveling outside Ghana upon completion and certification.
I'm going to read it. I'm going to end with on my other news platform that I am on. There's an editors meeting happening. The big story from Nigeria that we are following. Coincidentally, you see the thing out there. Ghana is on the list. Nigeria is on the list. The conversation in my Nigerian colleagues' newsroom this morning. The death of a doctor in a faulty elevator at a big government hospital in Lagos. The General Hospital in Odan. The doctors are talking about how hospitals hide new equipment and bring them out only when it's time for inspection. So a doctor has died in an elevator that doesn't work in the hospital. And you expect the other doctors who work in that hospital to show up the following day and think about how they are going to climb up that staircase for some surgery in that same elevator that has killed a colleague of theirs, when perhaps the federal government in wherever Odan is, that is Lagos, have known that this elevator hasn't worked for years. They never decided to fix it. The doctor can die. And this doctor, offer comes. Germany is calling. Canada is calling. Australia is calling. Where the elevator works. And you are saying the person is wicked for thinking about it. It's a damning verdict.
Yeah. It is a damning verdict, really.
Yeah, so the nurses are saying that they will not be on the countryside. They will be in London.
They'll be at that countryside, not on this side.
They'll be there, they will see we.
but I think that in all our shouting and our conversations, I think that we need to place a demand on the Minister for Health. A demand.
Is he around?
Say again?
Is he around?
You know, he's always quiet like that. He's a big man. So, Charlie, no, so that they come up with a strategy to manage this situation. Because they've been elected into their positions to do a job. Some way of stemming the tide. I mean, look, we cannot prevent people from traveling out of the country. But when it takes an epidemic proportion, I mean, the exodus is at an epidemic
Yeah,
proportion.
it's disturbing.
But 8 out of every 10 final year nursing students say that once they get there, they call something PIN. Once I get my PIN, I'm out of this country. It's dangerous for this country. It is very dangerous. And the more I get this silence from the health ministry and the health minister in particular concerning this issue, the more scared I become. I guess so scared about this situation that I don't know where we are going from here. Where nurses are living, look, 1,200. And these are the numbers captured officially by somebody.
Yep.
Captured officially by somebody. And I don't know how that somebody captured the numbers.
Those numbers.
I honestly don't know, because you see, look, if you go to the UK, for instance, they have the nurses register is almost 1 million.
Almost a million.
Almost a million.
Okay.
In excess of almost 800,000 and something nurses, okay? Some will be found on the NHS official. Some are just private. Okay, so if you add the private and the NHS, you are hitting 1 million. And they have a nurses need of close to 400,000 every year. They are not getting from England. They are not getting from Ireland. They are not getting from Wales.
They have to look out.
They have to look out. So they go to mainland Europe and get. Mainland Europe, they are also busily building their economies. The last month or so, Germany opened up.
Oh, yeah.
Yep.
And they're advertising it heavily.
In fact, atrocious.
They are advertising.
And
They slap you with it
after us.
everywhere. The German one, they slap you with it
And you'll
everywhere.
be shocked to know that even there are politicians listening to us who actually promise their electorate.
We are bringing more doctors.
Take you there.
That will give you connection to go to Abuchi. Only yesterday I was talking to somebody. He says that one of these politicians came to my constituency and in the campaign told the people that if you vote for me, I'll help you get a visa to the US. This is what you are promising the people, to vote for you to stay in Ghana while you help them to leave Ghana. This is such a bad narrative for what we are dealing with in Ghana.
And like you're saying, the silence of the authorities is huge. Let's get to the line. Let's speak to a nurse in the UK. For the purposes of this conversation, we'll refer to her as Attah-Mensah, and she's in the UK. And she'll just ask her a few questions, really, just to get an idea of the conditions there and compared to the conditions in Ghana. Hello, good morning. If you can hear me, welcome to the Citi Breakfast Show. All right, we'll work the line to see if we can get our nurse friend in the UK to speak to. Richard, you wanted to make a quick comment.
Well, I want to touch on the matter having to do with politicians or public service people or people in big positions not doing so much, it would seem, about the health situation in our country.
All right, just
and
okay,
yet
just
receiving care outside the country. Some people raised that in the text messages, and I thought I could just pass some comments on it. There are two issues here. The first one is whether public policy should guide the intervention of Parliament with a law to restrict ministers, MPs, presidents, doctors, and some of these big people who are policing the public health system of Ghana, to restrict them from going outside to receive medical care. A number of messages that came out this morning are saying that if you have people who are presiding over the mess we see, nurses engaged, yet they are not paid for so many months, in some cases for over a year. And citizens are receiving poor service delivery from the hospitals as a result of things like this. If these things continue, and yet the people presiding over the mess, anytime they are unwell, they gun You see them in British Airways.
Hop on a flight.
They're given special treatment. They are flying to the UK, South Africa, India in some cases, the US, France, for medical attention. The new destination, which is the favorite for many now, is Dubai, where a lot of procedures are being performed on our public service, officials, politicians included. The most annoying aspect of it is that while it is the case that they are presiding over the mess we're talking about, and many of us cannot afford to go outside for care because our pockets cannot support it.
Yep.
We, the good people of Ghana, through our taxes, are sponsoring many of these public officials so that they can go outside the country and receive care. So look at it. You and I, when we are unwell, we go to the Kolibus of this world, or we go to the the Kaneshi polyclinics of this world for care. In some cases, they will tell you that way they are into me go and bomb fire. That's what they tell you in some cases. And we pay taxes, right? With taxes go into funding Ghana generally.
Yes.
The conditions in the hospital are terrible. You go to our hospital, you see nurses overworked, which is true. You go to our maternity wards, in some cases, women are delivering on concrete floors. They have delivered in some cases, and they are sitting on benches. These are things that have been reported consistently in the past. Yet we have created conditions of service for public service, for public officials, for ministers, for MPs, for all kinds of people in many cases to be able to receive reimbursements for expenses that they make outside the country, for conditions that could easily have been treated here in Ghana. So that's one side of it. And if you look at it, you would argue that, well, I tend to agree with those who say that perhaps the time has come to intervene with a policy through legislation and stop public service people or politicians and all these big shots from feeding on the public purse when they go outside to receive medical care. But the other side of it is the Constitution guarantees freedom of movement and freedom of choice. Now, if you believe as a public service officer or you believe as a politician that the situation in Ghana in terms of the quality of health service delivery is not one that meets your personal requirements or the needs that you have as a person, your condition, and you want to seek help elsewhere, the argument is that you should be entitled to so do, given that the Constitution guarantees the right to freely move. So if you believe that you are...
But shouldn't that be done with your own resources?
So I'm coming to that. So if you believe that you should receive care in the UK for a condition that could easily be treated here in Ghana, you can hop on a plane and fly to the UK and receive care. The issue is whether the public should pay for it. As we speak, we can collect so many records of payments that the Ghanaian taxpayer has had to make because politicians flew out of the country to receive care, or some other people flew out of the country to receive care. I'm not saying that that by itself is bad. What I'm saying is, if you preside over a mess that is killing many people annually, should the public be paying for the care that you receive outside? And I'm saying that there is a constitutional argument to be made, and then also there is a moral issue also there. Now, which one do we want to take? Do we want to pass a law that says that, okay, if you elect to go outside, pay your own bill, pay your air ticket, pay for the security details will be on you. Okay, let's take this.
All right, let's Richard, we'll come back to you so you conclude. Let's get to the line. Let's speak to our nurse friend in the UK. Like I said, for the purposes of this conversation, we'll refer to her as Attah-Mensah, and she'll just tell us a bit of her experience in the UK as compared to what she experienced here. living conditions and all, looking at our conversation this morning. Good morning and welcome to the Citi Breakfast Show.
Good morning.
Thank you so much for joining us. We are having a conversation about, nurses and all of that, people leaving Ghana to go practice elsewhere. Can you just share your experience in the UK with us and maybe juxtapose it to what you experienced in Ghana before leaving?
Okay, sure. Nursing in the UK it's been a wonderful experience. And compared to nursing in Ghana, even though the foundation or the fundamentals were from Ghana, we find ourselves in the UK because our home country, Ghana, was not taking care of us well as we were supposed to be taking care of. I've been in the UK for 8 months now, and I can say there's been a major transformation in every aspect of my life, except for my psychological one, which I sometimes miss from, that is why. But when it comes to health, finances, and all, the change, you can't compare the changes. Nurses are being appreciated, taken care of, and treated better here than what we were experiencing before.
I see. So tell me, how long did you train in Ghana before? How long did you train and work in Ghana before leaving?
Okay, so I trained I finished my training in 2017 and I worked for 2 years after my rotation. So I was in active service for 2 years in Ghana before I relocated to the UK.
I see, and you're saying that you've been in the UK for 8 months, and in 8 months you can see a stark difference between what you experienced there in 2 years and what you have experienced there so far.
Yeah, that's different. The difference is very huge.
I see. In terms of wages, on the average, what's the picture like in terms of wages if you compare it to what you were earning in Ghana before leaving?
Okay, so on the average, when it comes, they have two wages: what they pay you post your OT and what they pay you after the OT.
Okay.
So there's actually not we don't have a specific salary we earn here every month because they are being paid on shift basis. So the more shifts you do, the more you get paid. But you can still stick to your contract hours, which I came with a contract hours of 36 hours. That is like 3 days a week. But you can do more. So if you want to take overtime and do more, it means at the end of the month you take home something bigger than what you were expected to take home per your contract. So yes, there's no fixed salary, unlike Ghana where we were having fixed salary every month and you were taking home the same thing, like they'll pay you every month. Here it's different. So in a typical month, if I'm just going by my contract hours, after tax I can take home around 2,200 pounds or sometimes 2,000 pounds. And this money I get to pay my rent and my bills in pieces. Like my rent and my bills are included. Like I pay it together.
Okay.
So I pay rent about 600 pounds. If you take that from my take home of 2,000 pounds, I still have some good amount of money left to save and to send some home. Unlike back home, you save your entire salary every month, and you use that same money to pay rent at the end of the year. That is one vast difference I realize. Because here you pay your salary, you pay your rent every month. Like as the month ends, you have to pay your rent. If it comes to bills, you pay together. If it doesn't come to bills, you pay separately. I find myself in an accommodation where I pay rent and bills inclusive.
Okay.
So after paying that, whatever is left is my money. Whatever I save at the end of the month or at the end of the year is my money. So I really need to save like 800 pounds every month. That's like 9,600 pounds at the end of the year. You just do the conversion into that's loads of money in just a year.
I see. I mean, just finally, would you advise your colleague nurses to take this path that you have taken?
I would say yes. People say that, so if you're all leaving, who take care of who take off your parent back home and all that? You get that a lot. Even at the immigration, when you are coming, the immigration officers will try to intimidate you, ask you why you are all leaving and if you leave, who take care of your parents and all that. But they should ask themselves, will we leave if we are being treated right? No, we will never leave because home is home, home is peaceful. All like we have our challenges here too, like adapting to the system here, the work environment, the work itself. It's stressful and all that. But then we have to come because we can't live the life or make a good living back home. If you are here, you can do something home. But if you are home, the number of years it will take you to do that something, I can't even like assume the number of years it will take you back home to achieve something compared to relocating. So I encourage everybody, if you have the means to write the exam, to pass the exam, to relocate, it's a very good opportunity. Now that it's become a norm, like day in, day out, people are relocating or their job offers. Some are saying it's difficult getting the jobs, but if you keep applying, you definitely get it someday, somehow. So yeah, everybody should come if you get the opportunity to.
Okay, I said it was my last question. I just want to ask this final one. You talked about, making money, earning, saving about £800. It leads me to ask, which part of the UK are you, and how is it possible to save £800 at the end of every month?
So I'm in Brighton. So let me clarify something. So when you come, you are being paid per hour.
Okay.
If you are being paid so you are being paid per hour. And let's assume a per hour rate is a £15. It's a £15. You multiply that by 12 hours. You run a 12-hour shift here. So even if you do,
you mentioned £15 per hour, right?
Per hour, yeah.
And then
so
you do, let's say 12 hours. So that's about £180.
£80. So if you work 4 times a week,
that's £720.
£720.
Yes.
So times 4 weeks, that's £2,880.
Okay.
Let's say tax takes like £500. Assuming tax even takes like £500 from the £280. Yeah, so like £2,000 to take home.
Okay.
Right?
Okay. I get the math now. Math now. Thank
so
you.
We are paid per hour by 12 hours.
Okay.
Per the number of days you work.
Okay. Thank you so much for your time. We really appreciate taking time off to speak to us. That was a nurse in the UK, Attah-Mensah. That's her name, and she's highlighting her conditions, and she just compared it to what she experienced here. And she says, look, if there are other nurses out there, she would advise them to do the same thing because their quality of life is better. They can make more money. They are paid per shift. They can earn what is commensurate to the efforts they put in. And generally, things get better for you.
And Nathan, mind you, what she has told you is about her regular job.
And
a lot of them do agency locum in addition to their regular jobs.
More often care related.
Yes. And the motivation and the reasoning behind that is that it can be very lonely out there.
Okay.
It can be very lonely. And one strategy some of them use is that the more you stay at home, the more your utility bills go up because of heating. And so they'd rather find themselves elsewhere working round the clock than to be home as young people. And if you look at the data from the UK, there about, if I get it correctly, about 60% of the health worker population fall within ages 21 and 40, like 70%.
Between 21 and 40?
Yes.
Okay.
So basically young people. And so you know how they express themselves, how they live their lives and engage with the system, And coming back to the point that Sky was making before you spoke to the lady, about policymakers and politicians subjecting themselves to the services that we render to our populace. You are in Europe, you are in England, and you take public transport, and you only realize when you are alighting that the next person sitting by you is actually a minister, an MP. You understand? Because this is the transportation system that they actually offer to the populace, but they subject themselves to it. So if it's going wrong, they know it's going wrong. Because if it's bad, then it's bad for us. But in this part of the world, if it's bad, then it's bad for them. You understand?
I get you.
And we have had repeated cycles of this toxic situation where politicians get into government, they become rich people. When they are out of government, they become poor people. And we say we don't see this. I mean, the blunt indication is that they are enriched when they are in government. Mm-hmm. And you don't need rocket science to know this. All we are saying is that while you are there, understand this reality that one day you will not be there.
Mm-hmm.
You will not always be there.
You will not be there. And when you are not there, trust me, the rate at which things are going, you will not even have the same resources that helps you to fly out when you are in need of any health service, to fly to England, to fly to
India, South Africa.
Dubai. You won't have it. But what you have now is to change the quality of services while you have the power, so that when you don't have the power, you can safely subject yourself to it.
That same system will save you.
And the nursing thing is taking an epidemic proportion. It is bad. Not just nursing. Health workers, physician assistants are leaving. The people who do the x-ray, how do you call them?
Radiologists.
The radiologists, they are living in droves. And we are sitting down, and all we are doing to measure the quality and the progress we are making in health is building more hospitals. Building more hospitals is good, but building an empty hospital is far worse. Because cockroach, rats will go and enter the thing.
Yeah, I see.
And then Abusumakutra, the Fiera, they will be all over the place because you have built the thing, but you don't have the health workers. Mm-hmm. Let's pay attention to this exodus. Mr. Health Minister, we are calling on you to do something about it.